2020 will always be remembered as the year of COVID-19, which has brought to the spotlight the courageous work of nurses, including pediatric oncology nurses around the world.
Before this pandemic, laughter was heard from children in the hallways, who come with their parents to carry out their chemotherapy treatment.
Up to now, our department has not recorded any case of COVID-19. However, there are many times we have to work in the environment as if they are COVID-19 patients.
So at first, we all didn't know what to do. We were unprepared. Patients were flocking onto the wards. They had no food to eat. They were not understanding the precautions that we are putting across. They were more worried of dying of hunger than of dying of COVID.
Initially, my fears were focused on the fact that Italy was, after China, the first country to face this unknown disease. I did not feel completely ready. I was worried about my health, that of my young patients, that of my family, and I also felt concerned about my elderly parents.
And now everyone uses masks. Children's parents and also the healthcare providers. We had to learn how to connect with our eyes, how to understand children only with what their eyes expresses.
In the day following the outbreak, the Pediatric Oncology Centers continued to develop oncological treatments.
COVID-19 has disrupted our normal ways of caring our patients. As pediatric oncology nurses, we have adapted and risen to the challenges during the pandemic.
We did not meet in person for our chemo class this year. Instead, we did a virtual event. We did it a few times and taught our nurses how to give chemo.
So there's been things that even post-COVID, when things go back somewhat normal, will still carry forward, and that's one of them.
Due to their pre-existing condition of isolation for cancer treatment, these young patients are already definitely prepared to face the COVID-19 emergency. After all, cancer patients have always been used to social distancing because of their immunodeficiency, and they already have experience with online interactions through social networks and video calls.
Thank God now we are coming to terms with the disease. We are learning, we are more prepared, and our patients have also understood the need for protection, and at least we are putting things in their right way.
Still, we must remain encouraged and hopeful that we will once again share joys, activities, laugh, and hugs.
We must also remember that nurses are not superheroes. Caring for others requires caring for ourselves, and if we do not take time for self-care, we cannot fully dedicate ourselves to the monumental task ahead of us.
Our journey as pediatric oncology nurses involves lots of learning, and none more important than understanding how we care for ourselves and our colleagues. At present, it's vital that we take time to reflect on the knowledge and skills and attitude that support our own mental health and physical well-being.
Although working in the state of COVID-19 is very stressful, we always create happy moments for ourselves.
During Childhood Cancer Awareness Month, let's try and improve our practice of self-care. Whatever aspect you choose to focus on, remember, it doesn't have to be perfect. It just has to be something that you really enjoy doing.